Good afternoon and welcome to the Animal Welfare Group Nigeria. We are highly excited to have you participate in today's presentation, and we'd love to interact with you as well, even in the chat as we go on with our webinar presentation. So feel free to introduce yourself in the chat. Let us know who you are and where you're streaming from. Just a bit of introduction about myself. I'm Dr. Yasiri Oluwaseun. My area of expertise is farm animal behavior and welfare. So I'm so excited to welcome you to the Animal Welfare Group Nigeria. And just a little bit of introduction about the group. The group was formed in the year 2019 after the gathering of lecturers and students at the Federal University of Agriculture, Abeokuta, Nigeria. And that was the time we realized that it would be great for us to bring ourselves together as a network where we can discuss issues related to animal welfare and collaborate with ourselves. So we have three main missions. Our missions are: number one, to increase awareness of animal behavior and welfare. Number two is to foster collaboration among stakeholders in animal welfare. And thirdly, to educate the public on the importance of animal welfare. And today, we have our speaker. She is Sylvia Gardeveg of the Division Companion Animals in Science and Society, Department Population Health Sciences, Utrecht University, the Netherlands. And the presentation will be on insights into dogs' acute pain signs, recognition by owners and veterinarians. So before I hand over to the speaker of today, I would like to take a short bio of our presenter. Sylvia studied veterinary medicine and completed her doctorate in surgery at the University of Veterinary Medicine, Vienna. During her varied career, she has worked in small animal clinics in Germany and Austria as a practicing veterinarian in night and emergency services with in-house patients and briefly in a laboratory. 1.5 years ago, she took the chance to return to academia and explore one of the most fundamental earthly phenomena, which is pain. Her research is focused on pain sign recognition, factors influencing pain perceptions, and interspecies differences in pain expression. To me, this sounds to be an interesting, presentation that we're going to listen to today. And it's so unique because hardly have I ever met, or listened to a presentation that have actually talked about pain. So you are all welcome from wherever you're streaming from. Thank you so much for joining. And with that, if you have questions for the presenter, kindly drop it in the chat and I'll be taking it immediately after the presentation. So Sylvia, over to you.
Thank you for having me today. And today I would like to speak about pain as a phenomenon and also give some insights into the project that me and my colleagues are working on. Over the past decades, there have been several attempts to define pain. And here we see a graphics that I took from a rather early study from 1969. And the description of pain here refers to pain as containing affective, sensory, and cognitive components. So already describing pain as not being only a sensory response, but a rather complex phenomenon. And about 10 years later, the IASP, the International Association for the Study of Pain, released its first definition of pain. And this definition described pain still as being closely associated with or connected with tissue damage. And this definition has been revised in 2020. And now the wording is a bit brighter, but the critics still say that it indicates that pain is associated with tissue damage. And therefore, several keynotes have been added to this definition. And one important keynote states that pain and nociception are, in fact, distinct phenomena. Nociception occurs when nociceptors are activated by a noxious stimulus, and it can evoke a pain experience, but not inevitably, because these afferent fibers forward the information to second-order neurons and from there to higher centers and ultimately to the brain. And only the message that enters the cerebral cortex is then consciously perceived as pain. So pain experience requires functional brain activity. Even if we have a patient under general anesthesia, we will see responses to noxious stimulation. But this patient is unable to consciously experience pain at the same time. And also studies have shown that pain experience can exist in absence of the noxious stimulation. But we now focus on the pain that arises from noxious stimulation, and along this pathway from the nociception to the brain, this message is influenced by several factors. And these factors can be internal, just like the current emotional state, or also past experiences of this individual. What can also be external, like social interactions or just the physical environment. One example for another emotion influencing the pain experience is fear. A fear of a very short duration can diminish the nociceptive message. And this is very valuable in nature because it enables animals to flee, even if they have very painful and severe injuries. But in turn, fear or anxiety of longer duration can amplify this message, so that the pain is felt more intense. And here we can see the connection to the small animal clinic or to whatever animal clinic, how important it is to make the animals feel as comfortable as possible. Because if the animals are in fear or if they are experiencing distress, this can increase their pain experience, and this in turn can amplify their anxiety and distress. So a vicious cycle develops. If an animal experiences pain, this is reflected in their posture, in their facial expression, and in their behavior. But in nature, being in pain is always a sign of increased vulnerability. So animals referring to a prey species may be easier to catch, or even animals referring to a predator species may be unable to fulfill certain tasks within a social community. So all animals are eager to not show their pain. Pain signs in prey species are often extremely subtle and almost not recognizable. And also in predator species, most animals are attempting to mask their pain. If an animal experiences pain, there are several categories of induced behavioral changes, and directly pain-induced behavioral changes are something like attention to the wound, limping, or the facial expression. Here we can see the example of a cat. The cat in the left picture is seemingly not in pain. She's looking attentive, the ears are facing forward, and she's in a more comfortable position. But in the right picture, the cat is in severe pain. How can we note this? So this cat has, just like the cat here in the picture, her eyes squinted, her ears are flattened and turned outwards, her muscle is razor tense, and her whiskers are more straight. And in several studies, it has been shown that these facial features are sensitive to the pain that the animal is experiencing, and depending on this, changing their shape or appearance. And in fact, these so-called action units have not been identified in cats, but in human neonates already in the 1970s. But they can be applied across species. And based on these action units, the feline grimace scale has been developed. And this is a pain scale solely focusing on the facial expression. And it can be used manually in the clinic, but it is also available as an app to be used by owners at home. This is very handy because it's not requiring any previous training, and it does not require physical contact with the animal. And the downside is that for technical reasons, it is not working for dark-haired cats, and it's of course not working for cats with facial injuries or deformities. But it's at least one tool that cat owners can use at home if they are lucky and it's suitable for their cat, to assess acute pain in cats at home. And with the mammalian facial muscles being evolutionary conserved, it is possible to apply this pattern across species, and therefore several species-specific Grima scale have been developed, as we see here, to assess animals' pain and ultimately welfare, not only in the setting of companion animal clinics or at home, but also in the laboratory setting or in farm animals. In dogs, it is always difficult because in most dog breeds, it is not possible to apply a Grima scale due to the skull formation. And so we have to rely on other behavioral aspects that could indicate pain. And this is called composite measuring. A very well-known and validated pain scale is the Glasgow Composite Measure Pain Scale. And this includes 6 categories containing different descriptors that are representing different degrees of painfulness. And it is reliable and easy to use for professionals, but unfortunately, it requires previous training, because if a layperson uses this, it is possible to score dogs that is showing signs of severe painfulness under the intervention threshold. And this is kind of dangerous if a tool like this is used by dog owners at home. But of course, dogs can experience acute pain at home after clinical discharge. And in this case, for the owners, it's often very difficult to differentiate between signs of stress due to the before hospitalization, signs of anxiety, maybe side effects of other medications, sedation, and signs of pain. But at the moment, though, pain scales to assess chronic pain in dogs have been developed and can be used at home by owners. There's currently no pain scale available to be used by owners at home to assess the dog's acute pain. And this was the underlying reason to start our project. And in the course of our project, we asked owners of dogs that were hospitalized at Utrecht University Small Animal Clinic to fill in an online questionnaire during the first week after clinical discharge of the dog, estimate the dog's painfulness on a numerical scale from 0 to 10, with 0 representing no pain and 10 representing unbearable pain, and upload a video of the dog showing behaviors that they believe that are pain-induced. 51 dog owners participated with 1 dog each, and the age of the dogs ranged from 4 months to over 12 years, and the gender were almost equally distributed with 24 females and 27 males. In each category, in females more castrated animals than in males, but the distribution was rather equal in total. From this 51 patients, 29 underwent soft tissue surgery and 20 orthopedic surgery, and 2 underwent solely medical treatment. The analgesics here do not represent the analgesics that the animals received in the clinic, but the medication that the animals were sent home with. And a huge proportion received NSAIDs, 23 from 51 received gabapentinoids, and 22 received paracetamol. 23 of the 51 dogs received a combination of 2 or all 3 analgesics. From the owner-provided pain scores, we determined the mean, and this mean was 3.59. So, and the scores ranged from 0 to 9. So we had examples of dogs that were considered to be in severe pain in our sample. And also the mean is indicating that some of the dogs were deemed to be in considerable pain by their owners at home. We subdivided the sample because we received entries during the whole week. some referring to the time frame very close after clinical discharge, and some almost at the end of the week. So we determined the mean for categories of the day of discharge until 2 days thereafter, days 3 to 5 and days 6 to 8. And a bit to our surprise, the owner estimated pain score did not continuously decrease, but increase by the end of the week. We cannot really determine the reasons. We cannot prove them, but of course we can estimate some reasons. And one very simple reason could be that the time frame for which the analgesics are prescribed usually is just too short. In this table, we can see the behaviors in which we ask the owners to document changes, and we extracted these behaviors from histograms of dog behavior and dog pain signs from literature, but also from experiences from clinicians working with dogs in the small animal clinic. And an overwhelming majority of the owners indicated to have observed changes in walking or in playing, either with an object or with the owner self, which is seemingly not that surprisingly after hospitalization. But it is also shown in other studies. Here we see a graphic from a study that was investigating recognition of pain by owners of dogs with chronic painful conditions. And from this study, it was resulting that owners are easier in recognizing movement-based behaviors. And of course, walking and playing is both movement-based and most likely somehow interrupting the normal daily routines of these patient owners and patients. And here in this graphic, it is a bit of a reflection of the owner estimation of the location of the painful area. And according to the estimation, the 50 of 51, or I think, I'm not sure, I think it was 59 participants or so, but every participant besides one indicated the pain to be placed in the legs. So it shows that owners are easier to recognize movement-based behaviors, but from there also conclude the most likely location of the pain. And this is, of course, sometimes also difficult when they communicate such observations and also their estimation to the veterinarian. We looked a bit closer in the subsamples again for the behavioral changes. And here we see that very closely after clinical discharge or on the day of clinical discharge, a huge proportion of owners indicated to have observed changes in urination. Of course, walking is still more frequently named, but almost 70% documented changes in urination. And we gave the owners the opportunity to not only tick a box, but also leave comments in a free text box. And many of the owners commented that they observed the color of the urine to have changed, or the duration of the urination to have changed. And this is also not provable, but when we think of a hospitalized dog, they in most cases receive intravenous fluids. It is very likely that this huge amount of intravenous fluids during hospitalization led to a lighter urine color and to an increased volume of urine, resulting in a longer urination shortly after discharge. 1 week after clinical discharge, the pattern has changed quite a bit, except from our peak documented changes in walking and playing, but we can see an immense decrease in documented changes in eating and urination. And this indicates that these are behaviors that are surely affected by pain, but most likely as well by many, many other influencing factors. and they are not very specifically sensitive, representing the painfulness of an animal. But which behavioral changes are representing the painfulness of an animal? To investigate which behavioral changes are representing an increased painfulness to the dog owner self, we tested with logistic regression analysis if the documentation of a certain behavioral change increases the chance of a higher owner estimated pain score. And a logistic regression analysis revealed that this is the case for walking, greeting the owner when he or she comes home, and exploring, just like sniffing or wandering around, and cuddling and petting by the owner. And for all of these behaviors, the chance that the owner estimated pain score increases was raised by 1.4. In the next step, we had the videos analyzed by 3 veterinarians independently to confirm if the dogs that were deemed painful by the owners were also confirmed to be in pain by the veterinarians, or maybe dogs that were not evaluated to be painful by their owners could though be in pain. And here are 2 examples. I will just let them play, and you can see just the original videos the owner sent to us. This was a 1-year-old mixed breed male dog that underwent surgery for an intrahepatic portosystemic shunt 4 days before the video was recorded. And the video was recorded 2 days after clinical discharge. By the time the video was recorded, the dog only received paracetamol. And here I chose videos where all vets fully agreed in the scoring. And in this case, all vets scored the dog 7 out of 10 and recommended an analgesic intervention. Whereas the owner scored the dog only 4 out of 10 and did not contact the veterinarian at the clinic by the time. The reasons why the vets scored the dog so high were merely that the dog is showing clearly motivation to get up, and he is 1 year old. He would surely want to get up and is also motivated by the owner, the sounds, and apparently the owner is sitting in front of the dog, but he is reluctant to show a full attempt because he's expecting this attempt to get up to be painful. So we come to the second case. So this is a 10-year-old spayed female Labradoodle. She's suffering from a lymphoma, and this was not her first surgery. She underwent lymph node resection 9 days before the video was recorded, and 1 day later she was already released. She received Caporal, this is an NSAID for 7 days, and paracetamol for 5 days. By the time the video was recorded, she did not receive any analgesics anymore. The VAD score was 2 out of 10 and no intervention recommended. The reason why it was 2 and not 0 was that the dog is still walking a bit stiff and carefully. But on the other hand, she is attentive. She is also wagging her tail and looking around. And this was maybe also the reason for the owner to score only a 1 out of 10. We then compared the pain scores that were scored by the vets with the mean owner pain scores, and the vets as well had the same numerical Likert scale for the video evaluation that was provided to the owners in the online survey. And we see that there's not a huge difference in the mean pain scores estimated by owners and estimated by the veterinarians. But then we looked at the cases separately and compared them with person correlation between the owners and the veterinarians, and this blue representing no or poor correlation, and redder or increasing red representing better or full correlation. We see that there is poor or no correlation between the veterinarians' evaluations and resulting pain scores and the owner's evaluation. This is, of course, concerning because it indicates that behavioral changes are interpreted differently by dog owners and veterinarians. And in this frame, pain might not be recognized or interpreted to be not severe enough. Of course, also the other way around, but the other way around is more harmless. But it clearly shows that owners need guidance and helpful tools to assess their dog's acute painfulness after the clinical discharge at home. From those owners whose dogs were confirmed to be painful in the veterinary video evaluation, we analyzed all comments they provided using a free text analysis program. And in this approach, we wanted to extract how owners describe dogs that are evaluated to be painful by veterinarians. And here we see that also most owners mentioned that the dog is not playing, but they very often used different phrases and words to describe that the dog is appearing sad or is quieter than normal and also sleeping a lot. Also, we can see that some behavioral changes mentioned are only possible to determine if a person knows the dog's personality, because many owners also indicated changes in the dog behaviors, like a dog keeping its distance where it is usually more affectionate, and the other way around, that dogs that usually spend more time alone or on their blanket, that they are more clingy. And this is always, of course, hard to recognize in a clinic because the animals are influenced by so many external factors that in some cases it is not possible to determine which behavior is normal for this dog and which is maybe influenced by pain. And putting all these results together, like the easy recognized behaviors and the phrases usually used by owners to describe the dog's painfulness, we have now created a prototype of a pain scale that will hopefully facilitate acute pain assessment by dog owners at home after clinical discharge, and in this way improve pain management in the home environment. And this prototype scale is currently under test with a new population of dog owners. And we hope that it can be established and validated afterwards and facilitate pain assessment after clinical discharge by dog owners. thank you so much for listening, and I'm curious to hear and read your questions.
Thank you so much. Thank you. I really appreciate this. You're welcome. Thanks for sharing this interesting presentation with us. So there's a comment here from Sanasi Mohammed. Good presentation and educative, but can we include tail swings amongst behavior to observe? Did you get
No, I never would evaluate a dog's painfulness mainly focusing on the tailback. Because dog behavior is way more influenced by social interaction than cat behavior in most cases, and so it can easily be misleading that the dog is wagging the tail in communication with the owner or with the attending person, and therefore it's not a specific indicator. I'm sorry if I phrase this in this way. Maybe it happened accidentally, but it's never a main factor to focus on.
Okay, can I ask this question? Is there any, because I'm just hearing about tail swings. I don't know if there's difference between tail swings and tail wagging. I know of tail wagging. I don't know if there's any difference.
I don't know either.
Okay. Okay. So the follow-up question is, I observed that the first, when you showed 0 to 2 days after discharge, you emphasized in terms of explanation, urination, but I saw the figure on walking and playing with objects. They were also very high at that point. Because if, let me say, a dog after between 0 to 2 days after discharge is walking and also playing with objects, how will you be able to know the level of pain that is still going through?
You mean when he's walking normally and also playing?
Playing, yes.
Yeah, it might be difficult, and this is a difficulty in creating a pain scale, because in a pain scale, walking and playing will just be categories among many others. So what we want to avoid in our pain scale is that a dog appearing to walk normal or play normal is scored under the intervention threshold, though he shows other signs that could indicate severe painfulness. And so the owners unproportionately often mentioned changes in walking or playing, but this does not mean that we lie a heavier weight in our scale on these behavioral changes. It only shows us that these changes are more often and therefore maybe more easily are recognized by owners.
Okay, thank you so much for that for that answer. I really appreciate it. From Emanuela Shogebi, wonderful presentation, thanks. I am a pain management expert. Are you open to collaborations, please? If yes, how does it work with you? Wow.
Oh, yes, surely. I mean, then we should have a discussion, maybe just in
Maybe.
person via video that is working from my side. And but of course, I think, and I'm working in a small group with 2 clinicians and one behavioral specialist, and I think, of course, always collaborations are possible.
Till today, I have always thought that, tail wagging has to do with a positive affective state, when the dogs are happy.
Yeah.
But now seeing the video that you showed, the dog was actually wagging it still, even though it was experiencing pain. So the question that I want to ask now, can we actually use tail wagging as a behavioral indicator of which kind of affective state now? Or is there a particular way the dog would wag its tail if it's in a positive state, which is different from how it will do it in a negative state?
Yeah, this is a very interesting and comprehensive question. I also thought that tail wagging is associated with a positive overall condition of the animal. And it also is shown in studies that the overwhelming majority of people think that. And from the videos that we saw, and from also the discussions with the other veterinarians, from which also one is a diplomat in analgesia, I learned that we have to evaluate it differently if we see it within an interaction or if the dog is walking on its own, because we received videos showing dogs wandering around and just like relax, broad tail wag. And there I learned from the behavioral specialist that also how high the tail is, how high the tail is just appearing. If it's really low, depending on the legs when the dog is walking around, this can indicate pain only together with other behavior changes. So not on its own, but it can be a further indicator. But if the dog is walking around and just like relaxed, broad tail back, then this is an indicator that the dog is probably not in severe pain. But if we see, just like in the video, the dog is wagging the tail in social interaction, he is communicating with his owner. Maybe he is apologizing that he's not unable to get up. So we can not use this tail wag as a positive indication or to indicate a good state of the dog.
Okay, thank you so much. I appreciate that. There's a question in the chat from Zainab Yusuf. Wonderful presentation. Please, have you done a research where you try to correlate subjective, pain assessment like the scoring system you explained with the objective scales like serum analysis, stress indicators and things like that?
You mean like blood, with blood
Yes,
values?
yes, please, yeah.
We have not done that. What we read from,
she said like interleukin 6 or B endorphins.
yeah, we have not done that. What we read from literature is that almost all blood values are also influenced by other factors and other influences that are coming from external or internal conditions. And therefore, it is very difficult to rely on blood values or physiological changes as indicators for pain. And just now in our current study, it was simply not possible because we would have to invite the owners to directly come with a dog to the clinic to get a blood sample. And so to make it perfect, this would be a great idea, also maybe for future studies, but in our setting, it was not possible.
Okay, thank you so much. Thank you so much. We still have time. I hope you're still, comfortable having more questions directed towards you. Yes, I also realized that using scoring method is a subjective, method of assessing, let me say, the welfare or even pain, as this case is. And when I looked at the comparison you did between owner versus the vets in terms of pain score at the early stage, which was 4 days post-operation, OP, there was this huge disparity between the scoring of the owner against a vet, which was 4 and against 7/10. But I realized that after a longer time, which is 9 days OP, there was this there's this closeness in the way they score this the pain score, that is 1 versus 2. Yeah, 4/10, the scoring system. The lower number, does it mean the more pain or the less pain in your scoring system?
Yes, it's more pain.
More
So
pain.
we had
Okay.
a numerical scale provided in the online survey. This was ranging from 0 for no pain and to 10 unbearable pain. And on this scale, the average owner estimated pain score after 6 to 8 days was 4. So it's considerable pain after almost 1
Okay.
week.
Okay, thank you so much for that clarification. So, for this OP, the owners actually scored the dog as experiencing more pain than what the vet scored. And that to me, for instance, what it means is that I don't know who is really, the right judge in this case. But if the vet is seeing the animal going through lesser pain, that means whatever medication, pain relief that will be given will be milder compared to, what the owner actually thinks the dog is experiencing.
Yeah. We had this in some cases, and it was really surprising to see that dogs that showed clear signs of pain in the videos were estimated to be not that painful by the owners and the other way around. And this cannot only be due to the observation of the animal, but also to the overall knowledge of the owner, because we sometimes really had comments saying like, I find it weird to ask for my dog's painfulness because he received pain medication. So just like if analgesics would give a guarantee that the animal will be pain-free. And these answers really show that owners would benefit from learning much more about dog behavior in general.
Wow. All right, please, what method of pain assessment was used? There's a question about that.
Yeah, we use the veterinary video analysis and the numerical scoring as a method, as an assessment method. Yeah.
All right. Thank you so much for your time. I really appreciate this, and I've actually learned a lot. So I shouldn't think that just tail wagging is positive. It may be negative as well. And I've also seen that scoring system is quite subjective, and we may not really still be able to pick the appropriate level of pain that the dog is going through. Thank you so much, Sylvia, for your time. So just a little bit of announcement before I leave. For those of you who are here, because most of us joined animal welfare because of our interest, a lot of us were not trained in how to even teach animal welfare courses and how to prepare a curriculum for this. So if you are here as maybe a vet or animal health specialist, or you're interested in animal welfare and you think the training or the education related to animal welfare is lacking, which I know most of us lack it because we didn't go through a training program that taught us about how to go about this. There is on the website of what's it called, the Vet United. There is a lot of modules that have been done, teaching modules that has been done, about 15 of them. Let me quickly rush through it. Introduction to animal welfare, animal care, humane handling, clinical examination, animal welfare assessment, animal welfare legislation, wound management, pain management, infectious diseases, responsible use of antimicrobials, vaccinations, euthanasia, animal transport, humane slaughter, fish welfare. All these modules are available on their website. I was trying to put it there, but if you are interested in the link, you can email me and I'll send you the link so that you can have access. It's a free online teaching program that you can use the resources even in your teaching. You can learn from it, and also you can use it in your teaching. And for those of you who are also health professionals related in Africa, especially now, and you want to join the Africa University, you must be a lecturer, the African Universities for Animal Welfare Network. You can also send me an email and I'll give you the link for you to be able to be part of the group. So also, there's the UFO conference is coming up in June. And it is a free online conference for people from developing countries. It is free. So please, these are opportunities where we get to meet people. These are opportunities where we get to learn and expand our knowledge about what we are interested in, which is animal welfare. So you can check out the UFO, that is the University's Federation for Animal Welfare website, and you can still register to have free participation online. It's an online conference, so you get to learn more from that. And also, of course, the ISA is coming up in August. If you are yet to register, the early bird has closed, I think, so you may have to pay for the normal fees. But yeah, with that, the ISA also is a conference, or ISA is also a society that you can as well be part of, and there are lots of opportunities to get. Any final thoughts from the participants? If you have any other thing to ask, feel free to let me know, then I can unmute you, and then we'll call it a day. We will be having another presentation next week because we had to shift this one from last week to this week. So then for next week, we'll be having another presentation on welfare implications of knife selection and usage in livestock slaughter, ensuring humane practices and ethical standards. So just watch out for the Animal Welfare Group page on LinkedIn, watch out for our group page on Facebook, and also on Twitter. You'll definitely get the link for you to be able to register on those platforms. So I should be able to post it, if not today, tomorrow, so you can start registering for next week's presentation on this topic. Thank you so much, everyone, for your time. I really appreciate it. Thank you, everybody. If there are no questions, Dr. Durosharo, do you want to say something? Any final thoughts?
Miss out any information. Now, Sylvia, thank you for that nice presentation on pain in dogs. I learned a lot of things. Thank you so much.
Once again, thank you so much, Sylvia, for your time and for sharing this with us. It's at least this is an insightful presentation, and we can go back home, thinking about what we have just learned, and maybe it will make us more observant and also see better ways by which we can detect pain in our animals early. Thank you. Do you want to give us some final words, Sylvia?
Yeah, thank you so much again. It was a pleasure for me to speak about this really interesting topic, because I also, during my clinical years, I got the impression that there's still much to do also among veterinarians to learn about pain. And I mean, this is such a fundamental experience that we can maybe make a huge improvement and impact for the animals.
Thank you, everyone, and have a wonderful day wherever you are.
Thank you.
Bye.